Me and Barbara were married for 51 years. Because she was diabetic, she was going for a checkup. And we just got outside the front door and she didn't feel too good. And she had a stroke. She understood she was going to a nursing home. And I said to her, "You'll be well looked after." I could see her deteriorating a bit each day. And then I got the call. I phoned my son up and he came. He got here before me. I got about 10 minutes later and unfortunately I was too late. She passed away. When it did happen, it was quite of a shock, but the life she had was excellent when she was here. You need someone to talk to afterwards rather than your relations or anyone, because you can't explain anything properly to them like you can someone else. Now and again I'll pop in and see them, all the people here. They said to me, "Don't forget, always come back and see us," which I do. She dealt with everything really. And now, when you're left on your own, it's hard, but you get through it. It's very difficult, but you do get through it.
What matters to me about the care delivered to the residents and the patients is at all times as gentle and comfortable as possible. Any pain is eased. If they seem like they're in pain, then not to be intrusive, not to do anything that would cause them extra pain. Holding their hands, talking to them, making sure that if they need a drink or that they wet their lips if they're dry and parched. That you talk to the families all the time, that you give them comfort, you give them somewhere to sleep if they need it. Communication is a big thing, especially with families and residents as they're passing. Even though they're in the state of passing, they can still communicate with you. So communication is a big thing. And just offering them as many choices as possible, making everyone feel involved so that they know that they're a part of this big thing that's happening.
I motivate the residents, I set up games, I try to make them happier, and I set up a weekly activity plan that I stick to. Because Crossways is a nursing home, you have to accept that they are going to slowly deteriorate in time, and the hardest thing of always accepting that they will become end of life and palliative care. So I think it's really important to give quality care through all the stages, to make it as comfortable and them as much respect and dignity as possible to them and the family.
So for us really, end-of-life care is making sure that somebody has a peaceful, dignified death, having that open door so that somebody's there for families to talk to at any time. Death is not talked about, but it's very important. It's very important that we make sure that we open those lines of communication so that we get the wishes and the preferences for the residents and their families. Often we get people that work for the NHS and for health that have never been into a nursing home come and see us, come and support us in the good work that we're doing. It's about supporting us, I think, especially with community services, especially around palliative care nurses, just giving us the support so that we can keep our residents in the homes. We don't want our residents going to hospital, and we can support our residents and their families with end-of-life care. Really the importance of bringing health and social care together is that at the end of the day, it's our resident that should be our focus and looking after that person in the centre.